So if you can just contact your local sexual health service, and we will make you an appointment to come in for a face-to-face consultation just with a nurse or a doctor to discuss the procedure in more depth. You can self-refer for a vasectomy procedure by contacting the team. Alternatively, your GP could refer you. So there'll be an experienced practitioner carrying out the procedure and also a healthcare assistant there just to assist with the procedure and to keep you comfortable at all times. There are different methods of a vasectomy procedure. The technique that we use is a non-scalpel technique, which involves a small puncture in the scrotal skin. During your consultation with the nurse beforehand, we will examine the testicles, and if we think that there will be complications with that technique, we will discuss alternative procedures. The vasectomy procedure is carried out with some local anaesthetic injected into the scrotal skin, so the procedure shouldn't be painful, but it may be uncomfortable. There are risks with the vasectomy procedure. You will see these risks in a little bit more depth on screen now. During the face-to-face consultation, we will assess whether you've got any allergies or intolerances, and if something is identified, then we will discuss this further. During the procedure, there will be a small puncture mark made at the top of the scrotal sac. Once this is healed, it may leave minimal scarring, if anything at all. So we do ask that you don't shave before the procedure, and also it would be preferable that you didn't wax the area or use any hair removal cream. It's asked that you just clip the hair really short, and the area to concentrate on really is just the base of the penile shaft and the scrotal area. Everyone's circumstances are different. During the face-to-face consultation, we will discuss this in more depth. There may be implications that you have to take some time off work after the procedure. "16 weeks after the procedure, we will ask you to provide a sample of seminal fluid. This will be examined to make sure there are no live sperm present. So sperm is produced by the testes, and because it can't travel up the tube post-vasectomy, it will just be reabsorbed back into the scrotal tissue. Seminal fluid is produced by the seminal gland. You will still ejaculate after the vasectomy procedure, but the seminal fluid should not contain sperm. You will have to use a reliable method of contraception until you get the all clear of your post-operative semen sample. So a vasectomy is considered as an irreversible method of contraception. So a vasectomy can fail, and this happens when the two tubes join back together. There is an earlier failure rate which can happen in about 1 in 200 to 250 patients, and a late failure rate where it can happen in about 1 in 2,000 patients. This will be discussed in your consultation a little bit further. So the hormone testosterone is produced by the testicles. It's then released into the bloodstream to flow around the body. The blood vessels are not affected at all by the procedure. Therefore, testosterone is not affected at all by a vasectomy. Because the blood vessels aren't affected by the vasectomy procedure, there will be no effect on your libido. If you do find afterwards that there is any effect on your libido, please get in touch with the team or with your GP. So vasectomy will not cause erectile dysfunction. If you feel like you are having issues with this after the procedure, please get in touch with the team or with your GP to rule out any other causes. No, vasectomy cannot lead to prostate problems, but if you were experiencing any symptoms, please contact your GP. Some people will experience regret following a vasectomy procedure. During the face-to-face consultation, we will discuss scenarios such as the loss of a spouse or the loss of a child, and how you would feel if you could no longer have a child or any further children.